I really feel that this program is one of the best in the nation.
There's a lot that I love about the fellowship.
This has been a really amazing place to learn from everyone.
And it makes for an amazing place to train.
I'm Wendy Armstrong, and I'm the Division Head of Infectious Disease at the University of Colorado. First off, thank you for taking the time to learn more about our fellowship training program. Although I'm a division head now, I was a program director for 17 years, and I firmly believe that training the next generation of ID physicians is a core mission for our division. To do that well, a fellow's experiences in their training program have to be intentionally designed with a goal to optimize the educational value. We also believe in personalizing every fellow's experience to meet their individual career goals and to help you figure out what those are. In other words, I want you to be prepared to get your dream job at the end of training, whether that requires 2 or 3 years to achieve. At CU, the opportunities are limitless. Our 4-hospital system with the University Hospital, the VA, National Jewish, and our public safety net hospital, Denver Health, allow you to see different patient populations with diverse pathology and to learn from experts in fields as diverse as mycobacterial disease, medical education, HIV prevention and treatment, STIs, the impact of social determinants of health on disease, hospital epidemiology and antimicrobial stewardship, orthopedics ID, transplant ID, just to name a few. But at the end of the day, our goal is to train you to improve the lives of people through compassionate clinical care, scholarship, and public health. And by that, I mean the lives of all persons with different lived experiences in diverse communities that need our care. It's been the commitment of infectious disease doctors since the beginning of our specialty, and it's the commitment we try to live up to here at CU.
I was a resident here, so I've been here for the last 3 years before fellowship, and I feel like that gave me a really good sense of the program and how amazing and supportive the faculty were. And so because I loved the people and I loved the program, I ultimately wanted to stay.
University of Colorado has a lot to offer. I think one of the things that I love the most is that it's a really diverse sort of patient population you get to take care of. You work at 3 different hospitals in addition to National Jewish, which is pretty awesome.
So we have a really great program here. In addition to the clinical experiences at all the 3 sites, we have specialty rotations that the fellows can do, and all of the subspecialty areas and infectious diseases that people may want to pursue for their career. We create those opportunities so then they get exposure and feel really well trained in fellowship.
We're trying to align our training with what your goals are for your career. And so if you're looking for an academic career, we certainly have opportunities to boost your resume in terms of that, in terms of research projects and lots of scholarly work. We're able to train you in specific paths of infectious disease. But for those trainees that plan to go into private practice, we also have opportunities to work with some of the private groups in town and get a feel for what private practice looks like as well. So it gives us the opportunity to very much customize your experience here to what you want to do after you graduate.
All of the clinical exposure is great, and then you combine that with it being an academic medical center with a lot of faculty with a strong passion both for research and teaching.
They're always willing to be mentors on research projects throughout their time here.
The university itself has access to a wide array of research opportunities, and we've specifically built the program to give the fellows additional time in the first year to help connect to scholarly projects.
Denver Health serves a unique patient population, including underserved populations. Another thing that makes Denver Health unique is that we have the Public Health Institute of Denver Health here on campus, and about half of the ID faculty who are based at Denver Health are part of the Public Health Institute. And what that really does is open up opportunities for a fellow, both in terms of exposure and opportunities for academic projects. Many people have projects just lined up and they would love help from fellows.
The VA healthcare system is a training site for about 70% of practicing physicians in the workforce. So we're lucky to have a VA here to help train our trainees at all levels, including the ID fellowship program. We see all comers, so general ID, transplant ID, orthopedics ID, just a lot of bread and butter type of cases. We do also have the occasional rare case as well.
I think one of the key things fellows can find here at National Jewish in terms of scholarship opportunities is actually our unique patient population that we do care for. It's one of the few places in the country where fellows can solely focus on the care and management of people with mycobacterial infections. There are a number of faculty that participate in clinical trials, and we have a fairly robust lab in terms of identifying and doing special studies on mycobacterium in general.
The University of Colorado Hospital has an amazing clinical program. It's a quaternary referral hospital, so that means that we bring in patients from both the immediate region as well as across the country and sometimes around the world for the specialty programs that it has to offer.
Also, here at the University of Colorado Hospital, we have a very strong orthopedic infectious disease training where we work side by side with our orthopedic surgeons, handling very complex cases. That is certainly a unique opportunity we have here.
In the area of transplant infectious diseases, we do organ transplants for hearts, lungs, livers, kidneys, and pancreases, and they do upwards of 500 transplants a year. That means that we constantly have busy services with lots of clinical opportunities for fellows to get training in that area. There's a bone marrow transplant program, that we have subspecialty services and oncology infections.
Another thing I really love about CU is that the attendings are all really supportive. So not just in mentorship and in doing research, but in the clinical arena as well. I have had only supportive attendings since being here.
I constantly feel so supported, and I feel like the program does a great job about checking in on how the fellows are doing, both professionally and personally.
Also, Colorado is a great place to live. Denver specifically is a great place to live.
I love living in Colorado. I feel like it has all the perks of a big metropolitan city, but you also get the luxury of being close to the mountains.
You can certainly have really great work-life balance. It's a great place to train.
We have a lot of opportunities, a lot of ability to modify our curriculum, get them connected to unique experiences, and then we really enjoy seeing the impact that has on them over time. At the end of the day, our success is people getting the kind of job that they want after fellowship.